Okay, welcome to the audio for the Unit 6 project for the pricing strategy project. My hypothesis is, can we decrease penalized costs by creating a dynamic staffing model for nursing? And this would be taking place in an inpatient rehab facility. So the whole reason for this hypothesis is that oftentimes nursing feels very understaffed, and there tend to be more costs with nursing, and then more costs with the facility because of materials and sending people out to acute care because of medical problems or falls that happen, or there's just medical accidents that happen, because most rehab hospitals are lone standing and they're not attached to another hospital. So the goal with this strategy is to increase patient safety, decrease the burnout of our nurses, as we are at a very high turnover rate nationally, improve patient outcomes. The better the outcome and the less time they're there, more patients can come in, where ideally you can make more money, which leads into increasing hospital revenue. So to develop an ideal nursing model can help achieve this goal. So I'll touch base about decreasing acute care transfers. So that means sending a patient from an inpatient rehab facility to and from the hospital. There are penalized costs that impact the rehab hospital only. With an increased length of stay, there's more money spent by insurance and government if it is a Medicaid patient. Increased length of stay and hospitalization. And then when you have an increased length of stay, less patients are admitted to the rehab hospital for therapy. So it almost, delays someone else's care if the staffing is not appropriate as well as the care being provided. And we will touch base a little bit on what those costs are and how much. So some current data. So there are some studies that have shown that when you increase the RN staff by 5%, it typically results in almost a 16% decrease in patient events that negatively impact your facility. So 5% is about a half of a full-time employee per records, where 16% of events, that's a pretty steep change in the amount of events that do take place on a weekly basis. Daily would be a little much, but a weekly basis. There's a study done on 30-day readmissions among almost 580 general hospitals. They found that higher levels of total nursing staff per patient day were a contributing factor in lower heart failure readmissions. So what that means is that the more staff you have, the more attention that is being paid to the patient, and especially with heart failure patients, they're pretty complex. But even as simple as a telemetry floor, you need the right amount of staff to make sure nothing bad happens. Technology does help, but it's sometimes not ideal for your complex patients. And the third bullet point kind of bounces off the first one. A 1% increase in staff helps by 3.5%. So even 3.5% is significant, where 1% increase in staff is at most a quarter of a full-time employee. So it's like having someone come in for a half a day. So just that little bit helps a lot. Another contributing factor is not having significant 24-hour supervisory coverage on the nursing team. So typically there's one charge nurse on day and night, as well as a lead nurse that's more on the floor. Your supervisory coverage kind of handles all of the administrative reasons as well as patient conflicts and complaints. And then something additional is just having a higher mix of nursing skill set during shifts that are more beneficial for clinical outcomes. So when you have a higher mix of skill, that does sometimes require higher pay for some of those nurses. So again, it kind of just comes down to investing in your staff to make sure you have no negative impact on your clientele that you have. And so I will touch base on like what reimbursement is for such facilities. So when a typical reimbursement for a stay in a rehab hospital is almost $1,200 per day. So that's one day. The average length of stay is 10 to 14 days. One acute care transfer costs roughly 11 grand per stay. And then if that person comes back to the rehab facility within 3 days, the rehab facility will have to pay the bill for that patient. So it's more than just that $11,000, but any other added costs like the ambulance ride, and anything else that's required. So you're looking at a lengthy penalty, that's just for one patient. And then so, there are some knowledge of numbers that some facilities see penalties up to $150,000 per quarter, where they may only have maybe 6 to 10 patients sent out in 3 months. So if you can cut that in half, you're making a much better revenue for your facility and patient safety. So this table shows a theoretical budget for a psychiatric hospital in Montana. It's a small bed hospital, but it just kind of shows salary benefits for an entire team in a facility. So obviously we're focusing on nursing. So this hospital has 11 nurses staffed, and that's the average salary and benefits per nurse. So showing a total of what they all cost as a whole. Then you see your total down at the bottom of the yearly budget for the staff. So benefits for this company costs about 11 grand. So you're looking at 68,000 per salary on average for a nurse. So it's a number to keep in mind for the next slide. So this chart is showing the modification of adding a 5% to your nursing staff. So that's half an employee. Salary benefits is the same, and then your total change in budget is about it's about almost $40,000 change in your budget. But then if you think about your savings and penalized costs, so 10 to 15% less transfers to the hospital is approximately 11 grand per patient. And then I will jump to the next slide showing the number in green is the more money that will be benefited from at a minimum. So it's about a $64,000 profit that you make, and that's just on the reimbursement side, not counting what you save in the penalized costs as well. Those numbers are sometimes kind of unique and very difficult to find, but I'm going to go back to the slide here. So all we did, I'll summarize, changed half an employee. That's all that's increased, and you're increasing your budget $40,000. And then so you're going to jump to the next slide to show that you're saving or making almost $65,000. So you are making out. And so this table is representing your annual projection gain from decreasing transfers to the hospital from 25% to 30%. So you want to be showing a 30% rather than 25 in what you're changing. So the reimbursement you see on the left side is based on 32 patients. Their average length of stay is 9 days. Total patient days is 288. And the effect on reimbursement is 343, 241.28. So it's a good profit. But if you can decrease by 30%, you then increase that profit by 65 grand. So just by changing your staff, the investment you make, you're still coming out on top. And yes, it may only be by tens of thousands of dollars, but as you invest your time into your staff and continue to make things better, those numbers can change even more as your expertise and clinical experience come into play. And in healthcare, we know you can't make anything go away in terms of patient accidents and people needing to go to the hospital, but if you can cut your numbers significantly by investing the right way, it will result in more green numbers than red. So this is an often hypothesis in facilities like this and in general in healthcare, but the big dilemma is more financially in the moment rather than planning, because once you start accruing these penalized costs, it's really hard to come back from them. And so it's hard to plan ahead when you're already been a facility for a long time, whereas for this project, this facility was new, and this strategy would have been really smart for this facility early on. But as you read through the paper, there is some information about that in there. So the last slide are the references used for this project, and that is all. Please let me know your feedback, and if there's anything, any clarification that you may need. Thanks.